Ang leg cramp sa may ngalay? Guess who? Si Ate Rose pa rin. In fact, kahit wala ka pang nararamdaman, abangers na siya. Meet Ate Rose. Short for Ate Rose Sclerosis. It's when cholesterol plaque buildup blocks the passage of oxygen-rich blood in the arteries. Sanhi ito ng cardiovascular diseases like stroke, peripheral artery disease, at heart attack. It's the leading cause of death worldwide. Bago lumala ang one-sided weakness, chest discomfort, or leg cramps, have it checked at Asian Hospital. Merong world-class equipment to detect artery blockages, international-grade medical service, and sulit screening and treatment packages. Now that you've met Ate Rose, you can do something about it here. Asian Hospital and Medical Center. Alagang Deserve, Alagang Sulit.
Good day! A new year often brings renewed energy, fresh goals, and a stronger sense of purpose, especially in healthcare where every decision can make a lasting impact on lives. Welcome to Freshly Brewed, where meaningful conversations, together with a cup of coffee, come to life through stories that matter. In today's episode, we take a closer look at how one of the country's premier healthcare institutions is setting the tone for the year ahead. Asian Hospital and Medical Center recently kicked off on 2026 with its annual gathering. Fantastic Six at 26, big idea, bringing together its leaders, healthcare professionals, and stakeholders in a celebration of vision, collaboration, and commitment to patient-centered care. Joining us today is the one and only Dr. Beaver Tamesis, President and CEO of Asian Hospital and Medical Center. We'll talk about the hospital's priorities for the year, the inspiration behind the Fantastic Six, and how innovation, compassion, and teamwork continue to shape the hospital's mission of delivering Alagang Deserve, Alagang Sulit. Let's listen in to this meaningful conversation with our very own Ruth Dela Cruz, BusinessMirror's Health and Fitness Editor.
Good day and welcome to this episode of Freshly Brewed. I am your host, Ruth Dela Cruz, BusinessMirror's Health and Fitness Editor. Asian Hospital and Medical Center always starts the year with a kickoff event where the management bears their plans for the year. This year was no exception. The theme that was adopted this year was Fantastic Six at 2026, the big idea. But before we talk about the hospital's big idea for the year, don't forget to subscribe to our YouTube channel and like and follow our Facebook page. To talk about the plans for 2026, let's welcome Dr. Beaver Tamesis, President and CEO of Asian Hospital and Medical Center. Good day, Dr. Tamesis, and welcome to Freshly Brewed.
Thank you again for having us. It's always a pleasure to be here with you.
Okay. So, sir, before we talk about 2026, let's talk about the year that passed. During your kickoff event last year, the theme was High Fives at 2025, which highlighted 5 key programs. Was Asian Hospital able to achieve these 5 key programs?
I'm very happy to report that yes, the whole community came together as one and actually slammed all the 5 key items that we were focused on last year. With the top one being our 5th JCI accreditation, using the most up-to-date edition of their surveys. So it was really something that really the whole hospital came together to make it happen. And we're very, very proud that we actually passed with flying colors.
Okay. And then I understand you launched the CyberKnife technology,
Of course, that was also another major highlight from last year. We finally brought into the country the very first ever CyberKnife precision radiotherapy to really be able to deliver ablative radiation for patients who need their tumors really destroyed.
Okay, and then you had your Ate Rose campaign where you won your anvil for this year. Congratulations for that. Yeah.
Yes, thank you very much for that. Ate Rose, we introduced her to the Philippines and to our country to help people understand what exactly atherosclerotic heart disease was all about and how we can actually combat this in terms of managing the cardiovascular and brain diseases that are a result of that particular problem.
Okay. This year's kickoff event the theme was Fantastic Six of 2026, the big idea.
Right.
What does this mean to you personally, and why was this the right theme to open the year for Asian Hospital and Medical Center?
It's the right thing for us because it really is again cements our role with the community, being able to reach out and give to those less fortunate in life, which is why the B stands for Bayanihan.
Okay.
We were just able to inaugurate our new 29-bed ward for the less fortunate in life. Those will be PhilHealth beds, so that as much as possible they have less or no balance billing if we can afford it. For the most part, I think we can.
Okay.
Working with all the communities, with the DSWD, with PhilHealth, etc. All of this has to be powered by innovation and information technology. But the other thing that's also part of this, where the community has to be involved, is the growth and development of our people.
Okay.
Asian Hospital cannot grow to the heights that we want if our employees, if our peers, our colleagues are left behind in terms of their development. So we realize that this is an area that we need to give a lot of emphasis and training on. So that's why we put it as part of our real plans for 2026, solid plans for 2026.
Okay.
We'll also
What
be
else?
continuing our campaign to defeat atherose.
Okay.
So our ability to continue raising the awareness and how we can actually now have actual treatment and preventive strategies to address atherosclerotic heart disease or even the ones that causes stroke in the brain, etc.
Okay.
Then, of course, all of these we have to wrap together in an integrated disease approach so that patients don't get lost
Yes,
in the
yes,
maze of a big hospital such as the Asian Hospital. We need everybody to be in that immediate vicinity where the patient enters, so that kumbaga, all the touch points are there, so that there's little navigation further required. For example, if they need, they come in for varicose veins.
Yes.
They may think it's just simple veins that are very prominent on the legs. Yung pala, it's a big problem. So the surgeons are there, the aesthetics are there, the nurses are there, the techs are all there to be able to delineate the problem so that the patient doesn't have to move from location to location. All right? So all of these things, improving access, I think is also going to be really critical as part of our
Okay.
big ideas. How we make Asian more accessible to the community, be it through just simple things like improving our parking,
Yes.
or even just yun na nga, all of these measures for better financial stability on the part of the patient, so that when they come to us, hindi naman sila mabangkarote
Okay.
because of a serious medical illness. So that's what we mean by access. It's both financial and physical access to our facility.
Okay. So, how do you ensure that these priorities don't stay as boardroom strategies but become lived values across the hospital?
That's why the kickoff was really important, because now we communicated it to every single employee. This is our priority. These are the standards and norms that we expect of you, and you can expect that from us also. It's a
Okay.
two-way street. We always regard it as tulong-tulungan talaga. It's not just management dictating.
Yes.
It's both employees also helping management achieve
Okay.
its goals. So it's always a two-way street when we look at these campaigns. Para it doesn't just sit in some nice PowerPoint
That's
presentation.
true. Okay. Okay. So, Doc, you mentioned earlier that growth and people development is one of the core pillars. How does Asian Hospital support its doctors, nurses, and staff as both professionals and individuals?
So, what's really important is we identify kung saan pa kulang yung skills nila, which is why we spend so much time looking and addressing our competencies and finding the gaps. When we have found the gaps, we will put in specific training programs for that particular person to get to the next level of their
Okay.
career growth and their development. For doctors, we're looking to be able to support specialty training that we may not necessarily have within Asian Hospital,
Okay.
be it external, locally in the country, or if we have to send them abroad, we will do that. We're very willing to invest in our key doctors.
Okay. And then innovation with heart technology and
Yes.
innovation are central also to healthcare today.
Absolutely, yes.
How does Asian Hospital balance digital transformation while preserving compassionate, patient-centered care?
It's important to choose the right technology, right? Artificial intelligence. Everybody's talking about it. But you have to use it smartly, wisely. You have to use artificial intelligence that was trained in the Philippines, or at least trained in a market very similar to the Philippines, so that we can properly adapt it and not just swallow at something hook, line, and sinker from some Western country, right?
Yeah.
That way, we can get the best technology with the best possible results at the least possible confusion for our doctors and our patients.
Okay.
And then improving the technologies of even picking up the phone or chatting with patients. These are things that we have to invest in so that we can really have our patients better coming in. At the same time, we're able to better address their particular needs.
Okay. You mentioned also Bayanihan Services
Yes.
and the Defeat Atherosclerosis
Yes.
campaign. They stand out as community-focused initiatives.
Right.
So why are these advocacies important to Asian Hospital's identity?
It helps Asian, again, cement its reputation as being a top-notch center, addressing the biggest health needs of the country. We all know that cardiovascular atherosclerotic disease is the number one killer, be it in the heart, be it in the brain. We have to position ourselves here. We have to play in this space. Otherwise, we become irrelevant. At the same time, we see the growth of other non-communicable diseases, particularly malignancies. So we have to also ensure that we are suited and capable to bring in the newest and best priced technologies so that patients do not suffer unnecessarily from excessive pricing or even just the ravages of the disease.
Okay. The introduction of Ate Rose brought a lighter, more engaging touch to a serious health issue.
Yes.
How important is creativity and storytelling in driving health awareness?
This is something that people don't give too much time about, right? People just assume that, because it's there, it's your health, then of course you'll take care of it. No. We have to motivate people. We have to help them understand. Which is why when we came up with the atherosclerosis Ate Rose campaign, it was like everybody had a big smile on their face just to see the concept. Because suddenly, yung pala yun? So, and then they better understand what's going on, right?
Yes.
It makes it more real, more feelable, kumbaga. So that really helps. I mean, like if people understand and appreciate the disease, how they can get control over it, then of course they'll now be better able to manage their diabetes, their blood pressures, the heart disease. Stop smoking, right? Because atherosclerosis is so related to acceleration of atherosclerosis and smoking. The two together are really, really vicious circle talaga.
And Ate Rose has already had big fan base, I understand.
Yes, I understand that also from my digital people. They're telling me that over 110 million people have viewed the videos. So that's great.
So looking ahead, by the end of 2026, what would success look like for you? Not just in metrics, but in how patients and employees feel about Asian Hospital.
It would be fantastic if patients feel that they can access us at any time. They can come to us without fear of financial loss or financial ruin. Employees, it would be great if they really feel, we see the sense of loyalty, the gratitude that we actually nurtured and grew their career. When a nurse finally decides to go abroad, I know it's a difficult decision, but if they can get a really high-paying job in a subspecialty, be it operating room nurse in cardiac surgery, she would be extremely valuable. I'm sure she'll be able to uplift her family quite dramatically with that kind of economic compensation. When I see these success stories for our patients, for our employees, that makes me happy because now I know that we've done our job. Done our job to taking care of the patient, taking care of the community, and our employees.
Okay. So if there's one big idea you want every member of the Asian Hospital community to carry with them this year, what would it be?
I think bayanihan, that's why it's number one,
bayanihan.
Really helping out each other. I mean, like if you look at the root cause, the root etymology of the word bayanihan, it's all about bayan, it's all about community, helping each other out. And the hospital system is really something that's so integrated. Everybody has a role to play. So it's really important that we inculcate deeply that bayanihan attitude na tulong-tulungan talaga tayo. No man can do all the job alone by themselves. We all need to work together for the better of our community, of our patients, and our employees so that we can all uplift everybody.
Okay. So, Doc, so what is your message you want to leave behind for our audience?
Healthcare is complex, but if we work together, choose the right tools, it can actually be surmountable, these healthcare issues. We need to understand that everybody is really trying to help the country, improve the systems, but by working together, we will find the solutions.
Okay. So with that, we would like to thank Dr. Beaver for sharing Asian Hospital's plans for the year, and we hope that you will achieve those goals so that you will be able to further strengthen your commitment to make quality healthcare, or Alagang Deserve, Alagang Sulit, accessible to more Filipinos.
Thank you again very much, Anne. Always a pleasure to speak with you.
Yes, thank you. This has been Ruth Dela Cruz, BusinessMirror's Health and Fitness Editor, and watch out for our next episode of Freshly Brewed.
And that wraps up today's episode of Freshly Brewed. Thank you for joining us as we gain insight into Asian Hospital's vision for 2026 and the leadership behind its Fantastic Six, Set 26 big idea. From strengthening patient care and innovation to empowering healthcare professionals and communities, today's conversation highlights how purposeful leadership can move an institution and people it serves forward. As always, meaningful change begins with clear direction, shared commitment, and a heart for service. For more stories and updates, visit businessmirror.com.ph and follow us on our social media channels. Stay informed, stay inspired, and we'll see you next time on Freshly Brewed.
Asian Hospital and Medical Center continues to grow, bringing world-class care closer to every patient. Introducing the Asian Health and Medical Clinics, your extended home just a few meters away from Asian Hospital, designed for specialized, holistic, and patient-centered care. Offering services such as scoliosis and stroke therapy, neurodevelopmental care, and the Men's Health Clinic, bringing advanced treatment within your reach. With expanded facilities at the Mercedian Building, we house the Center for Physical and Rehabilitation Medicine, featuring an Activities of Daily Living, or ADL, facility to help patients regain independence and return to their normal routines after surgery. Neurodevelopmental services and essential administrative offices, ensuring seamless, coordinated care. As part of our High Five para sa 2025 campaign, this expansion reflects our commitment to a healthier future of our community. At Asian Hospital, we deliver the care you deserve, the care that's truly sulit.